Hello everyone. In this video, we are going to talk about the dampness. The dampness is another exogenous pathogen. On the definition, dampness refers to the factors that have the characteristics of heaviness, stickiness, and having the chance of moving downwards. And when we talk about the pathogens, especially for these exogenous pathogens, we have discussed the wind, the coldness, summer heat, and now we talk about the dampness. You see all these words from the introduction, we said that all these words are the climatic factors in the environment we can see. So when we try to understand this kinds of what kinds of characteristics are these pathogens have? Do these pathogens have? You need to think about the actual dampness or the actual wind in the environment. What kinds of characteristics the wind will have? Same as here, the dampness. As you can see from the picture on the right side, the dampness actually refers to humid. So that's the humid or the moist at on the bricks indicates the dampness there. But you see here, it's actually in a corner or at the bottom of a house. You see the dampness have the chance to move downwards. And when the dampness is going to dry, it also dry from the top to the bottom. That's also, they will dry from here. And then these are the last area when they go to dry. So the dampness will have the chance to move downwards. That's one of their characteristics. And then dampness, same as other pathogens. When we discuss the pathogens, we're going to start from where they're from or which seasons they are linked. So dampness, they happen also in summer, and from the time you see very similar to summer heat. It also happens in summer, also late summer to early autumn. But from here, dampness, there's no heat. Summer heat is the combination of dampness and heat, although they happen in the same seasons. So in this area, in this period, it still rains a lot. And then because of in summer, the heat will cause the humid climate in the environment. This kind of environment is very similar in Durban, the climate in Durban. So that's the dampness. The dampness, apart from the season, it also can happen from someone they live the environment very humid, or they live like on the ground floor or even at the basement. Or some fishermen, they work in the water. They soak in the water all the time. All these long-term career or long-term habits will cause dampness, and these dampness will affect our human health. You know what kinds of characteristics dampness has? Dampness is an pathogenic factor that impairs yang qi and easily obstructs qi circulation. So from here you can see the first dampness is yin pathogen. Yin pathogen will affect yang. That's similar to coldness. But when we compare with the coldness and dampness, coldness is something you can't see. It's formless. And dampness, as you can see from the picture, that's something you can see. Something you can see, this means that the physical objects, in our body will obstruct qi circulation. That is because the physical objects, the physical materials in the meridians or cholesterol where the qi and blood moves. But now the pathways are occupied by the dampness, so the qi and blood have no opportunity to move. That's why it says the dampness can obstruct the qi circulation. It will stop the qi of moving. That's because they will obstruct the pathways. That's from the dampness. This dampness, when we study the Zhangfu theories, we said that the spring prefers dryness and hates dampness, because the dampness will affect the spring. The spring's function. It will cause the poor spring function, which cause the internal dampness, and also such as diarrhea, edema, or less urine. So these are edema in the low extremities, in the legs. Also, the patient have distending abdomen. As you can see here, the symptoms we talk about are actually more close to the lower part of your body, in the legs. The urination also in the lower jaw. So in the middle, lower jaw, these are the lower parts of the body. So compared with the wind and the yang pathogen we haven't mentioned, actually we're going to mention that later in the fire. See here, why we mentioned the lower parts of the body. That is because the dampness has the trend of moving downwards. That's why most of the symptoms happens in the lower part of the body. This symptoms also can happen in the top part of the body, such as the head. But when the dampness go to the head, normally it will be combination with the other pathogen, which is yang pathogen, and help the dampness to go up to the head. Dampness is characterized by heaviness, the second characteristic. So because of dampness is a physical object, it's very similar. You put extra water in the legs or in certain parts of your body, then you will feel the heaviness. That's also the characters of dampness. And this kind of heaviness, it depends on which parts are affected. If the head is affected, so if the patient suffers from headache due to dampness, and then this kind of headache, the patient can feel heaviness in the head. In Huangdi Neijing, it described as kinds of feeling of headache due to dampness. It describes that the patient will feel that the head feels like covered with a towel. You're going to use a cloth to cover your head, a lot of cloth to cover your head. That kind of feeling due to dampness. And also, if the dampness happens in the joints, they will feel the joint pain and also have that kind of heaviness feeling. The dampness also can go to the intestine, cause diarrhea, even the diarrhea with blood. Dampness, when it goes to the bladder, it causes the urine problem. If it go to the uterus or in women, it will cause the abnormal discharge from vaginas. If dampness happens on the skin, it will cause skin disorder. It depends on which area the dampness goes to, and then the dampness will obstruct the circulation of the specific area where it goes to. The last characteristic of dampness is viscosity and stagnation. Viscosity is very similar to sticky and stagnation. Sticky, it refers to the symptom is sticky. So the symptom is, when the symptom is sticky, what does it mean by sticky symptom? Sometimes the patient will tell you that in their mouth, they feel their saliva is sticky, so like the oil. They don't feel good in the mouth if they feel sticky. And sometimes they have sweet taste in the mouth. Also the tongue, the coating of the tongue can be a thick, greasy coating. Why they have a sweet taste in the mouth? That's because of the dampness affect the spleen and then results in the sweet taste in the mouth. And this kind of sticky, apart from the mouth, it also can happen in the stool. So the patient will have sticky stool. For sticky stool, sometimes when I talk about the sticky stool, people laugh. How do you know sticky stool? So how do we know sticky stool? There are two ways to know. The first is you will feel hard to clean yourself after you go to the toilet. So that's the first sign of sticky stool. You feel harder to clean yourself after you go to the toilet. The second sign is when you flush the toilet, your stool will leave something on the toilet. You need to use the brush to clean the toilet. So these are the two signs of sticky stool. The sticky stool also a sign of dampness in the intestine. And more common symptom is after you go to toilet, you don't feel good in your anus. In anus, you still want to pass something out, but there's nothing there. That kind of feeling, also due to dampness. So and all these symptoms are due to the viscosity or due to the nature of viscosity, the sticky characters of dampness. The viscosity also refers to another aspect, is that the pathogen of dampness or the diseases that is due to dampness, they will stay in the body for a long period. It won't go away in a few days. We are going to discuss a topic on fever, how to treat the fever with Chinese herbal medicine or acupuncture, or how to analyze fever in our clinic in future. And then when we discuss there, you will see some cases, some patients they have flu, and then they can recover in 1 or 2 days. Sometimes they can recover within a few days, within 7 days or 5 days. But you will see sometimes some patients Some flu, they will last for more than 1 week, up to 2 weeks. Why with the diseases of flu, different patients have different symptoms, and especially for a period, it lasts much longer than others. One of the reasons is because of the pathogen. If the flu is due to the dampness, the course of the disease will be longer. And also, sometimes for arthritis, some kinds of arthritis takes much longer to heal. That's also due to the dampness. Literally, for dampness, how we describe dampness in our body. If you want to dispel or clear the dampness in the body, how difficult it is, that in literature we describe that the dampness and the human body is very similar to the oil with the flour. When you bake your cake, you mix the oil with the flour, and then imagine the oil is the dampness. The flour is your body. You want to take the oil out of the flour, and you will see how difficult to clear the dampness. So that's the meaning of viscosity, and also the change of moving downwards, and the character of pathogen. Dampness is very easy to attack the lower parts of your body. So these are the characteristics of dampness, and is related to summer and related to the spring, to the earth, in the organs. As you can see from the table, that's the different symptoms of dampness, and you can see that most of the symptoms are related to the lower parts of our body or the lower parts of the organs. That's due to dampness have the chance to move downwards. The next pathogen is dryness. Dryness is another pathogen in autumn. So as the season changed from summer to autumn, especially at the end of summer, it rains a lot, and when you go to autumn, it becomes dry. It doesn't rain a lot, so this dryness refers to the factors that have the characteristic of dryness. So it's very obvious from the name, the title of the pathogen. It refers the characteristic of itself. And because of the dryness, it's related to autumn, and autumn is also related to the lung. So the dryness is very easy to attack the lung, cause the dryness in the lung. When we have dryness in the lung, we will cause coughing, and this kind of coughing is dry cough. So you don't see a lot of phlegm in the lung, and also even if there's some phlegm, the patient will tell you that it's very difficult to cough out. It's because of the dryness. When the phlegm becomes dry, it was concentrated more, and it become sticky. That's why it's not that easy to cough out. And then this kind of dryness, if it happens in the skin, it will cause the dryness on the skin, or on the lip. You can see the lips, it's dry and cracking. dryness, the patient can feel dryness in the mouth. They feel thirsty. They can feel dryness in the throat, or they have less urine, or constipation, or very dry stool. And you see, these symptoms are actually due to lack of water or lack of body fluids. It's very similar to the picture on the right side, dryness. The dryness causes the cracking. The cracks, if these happens on the skin, because we have the cracks on the skin, that's due to dryness. The dryness depletes body fluids, causes various dry symptoms. These symptoms can be anywhere. It can be the upper body or lower part of body. So the most important aspect is dry. And the dryness, it can happen in autumn. It also can happen in summer. If the climate becomes abnormal, if there's not enough rain, or if there's no normal rain as usual, it will cause dryness. So it can happen in all different kinds of seasons. As long as there's no rain, it will cause dryness. And dryness tends to damage the lung. That's because the lung prefers moist. We go back to the Zhangfu theories, you will realize that the lung prefer the moist, but the dryness is going to cause the dryness of the lung. And also the dryness related to autumn, and autumn related to the lung. That's also why it's more easy to cause the lung problem. If the dryness happens in the lung, the patient will have cough with less phlegm, or even when it becomes worse, the vessels also become dry and the blood coming out, so the patient can be coughing blood. And the lung and the large intestine are coupled the paired organs. So the dryness in the lung is going to affect the dryness in the large intestine. This will cause the constipation. So these are the characteristics of dryness. You need to focus on dry, and also on the dryness, as you can see from the soil, the earth the earth in the picture on the right side. When it becomes dry, you think the soil, the earth, is flexible, soft, or hard? Obviously, the answer is the soil will become hard. So it's not easy to move them, to change the shape of them. So that's also exactly why in some kind of treatments, if the patient have some kind of sparring, and or it's very bad flat, the joints is not flexible in this condition, we also can think about dryness. Is it the joints lack of body fluids? If the joints lack of the fluid, you become dry, and then when it becomes dry, it will be similar to the picture there. The muscle become crack, and it's not exactly a muscle, but when I say so, just help you to understand easier why there will be the movement problem, why that this kind of patient is not flexible in the joints. What we can do, so same as the earth of the picture, on the picture, how can we fix the dryness? It's very easy. The answer is You just pour water there. That's how, you see exactly what happens in your house, in your garden. In a garden, when you want to plant a tree or a flower on the ground, what you can do, you can pour a bucket of water there first, and then the second day, you ask your gardener to dig the hole for you. It will be much easier for him to dig the hole while the soil is very dry. That's because of dryness. So the water can change the dryness, can help the soil become flexible. That's exactly how we're going to treat the flexible problem of the joints, sparing of the joint or sparing of the joints. What are we going to do? We're going to use some herbal medicine to increase the body fluids in specific area, or we're going to use acupuncture points to improve the body fluids, such as from some meridian which is full of blood, which you still remember which meridian is full of blood, or which meridian has more blood than others. Or you can use in meridian. You can use the meridian where the water come from, the body fluids come from. That's how we're going to apply the treatments on these pathogens. So these are the symptoms of dryness. The last pathogen we're going to introduce is the fire. The fire refers to the factor that have the characteristic of heat, the trend of moving upwards. As you can see from the fire in the picture, the fire, you can see the flame. The flame is moving upwards. That's why the fire have the trend of moving upwards. And when the flame moving upwards, as you can see when we cook, when you brine, you put your food, you put the meat on top of the fire, right? That's because of the flame. It's hot on top compared with the flame at the bottom or even underneath the fire. So you have the trend to move outwards, and this trend, when it happens to our human body, is very similar to the wind, yang pathogen. Fire is a yang pathogen, and you have the trend to move outwards. When the fire moves outwards, it's going to burn the upper parts of the body. Where it's going to burn? If the fire in the mouth, we got the mouth ulcer. We got the ulcer on the tongue. We got ulcer in the throat. Or we have nose bleeding. That's because the fire break the veins in the nose. Or you can see some blood in eyes. That's also due to the fire. So sore throats, sore eyes, sore mouth, ulcers in the mouth, that's all because of the fire. The second, the fire often consumes the body fluid and qi. Fire is a yang pathogen. If there's a fire, there's less water. This is very similar to the dampness. If there's dampness in the body, that body will have less yang qi. So when we talk about yin and yang, you will need to, although we focus on one side, you will always need to think about the other side. This is very similar if in your garden it's wet or it rains now, the garden is moist, and after in a few days the garden is still moist, so there's a lot of dampness there. If there's a lot of dampness, you will assume that there's no sun these a few days because there's not enough yang qi to dry the garden. That's why wherever there's dampness, there's no enough yang qi. Same as here. Whenever there's fire, you will consume the body fluids because the fire is going to dry the body fluids. It's very similar when you cook food on top of fire. The food is going to be dry. When the food is going to be dry, it actually just means that the water in the food becomes less. That's in this condition. If it happens in human body, it's going to cause the dryness or lack of body fluids before dryness. This can happen such as constipation. Or thirsty or less urine. And when the fire consumes the body fluids, it is not only going to consume by the fire itself, it also can help. It's very similar when you cook something on top of fire. When the water become boiling, you can see the steam is coming out. Steam is coming out. That's also the water from the pot. So this also will cause the body fluids to go out of your body, which in terms of sweat. So for fire, and then this is very similar to summer heat, the body fluids and the heat and qi. When you cause the sweat, you also have less qi because the qi is going to reduce from the body fluids, from the consumption of body fluids, and then the patient will feel fatigue. The fire is related to the summer, and the summer related to the hot. So the fire is more easy to affect the heart, will cause insomnia, will cause irritation or unconsciousness. So these are all due to the fire. The fire is characterized by stirred up liver wind and often involves hemorrhage. The bleeding. Why the fire will cause bleeding? It's because the fire burned the vessels, and the vessels was burnt by the fire, and then the vessels lose the function of controlling the blood in the vessel because the vessel is broken. That's why. Stirred up liver wind. That's because this fire is liver fire. The liver fire will cause dryness, and also you can see the fire, the flame is moving. Why the flame is moving? That's because of the wind. So this will be called the internal wind, the liver wind. And then in this condition, the patient will have trembling. We have trembling or spasm in the body. Doesn't have to be in the extremities. It also can be a spasm of the muscles. So this kind of condition we says the internal liver wind. And for the bleeding can cause any kind of bleeding in the body, from the top part of the body to the bottom part of the body, such as nose bleeding or vomiting blood, bleeding in the urine, or bleeding under the skin, which is like bruise. Or in ladies, it causes excess menstruation. The last characters of the fire may cause carbuncles, furuncles, or ulcers. These funny terms are not sure is in Western medicine they also use these terms or not. This actually refers to the inflammation on the skin. So the skin inflammation or the skin ulcers. These ulcers, this inflammation also can happen in the organs, such as the lung, some kinds of pneumonia in the lung. It will cause the pus in the lung. This also in Chinese medicine we think that due to the fire. It's because of this symptoms due to fire, and these symptoms on the skin we have the characteristics of redness, swollen, hot feelings, and painful. So these are the characteristics of fire. When we talk about the fire here, we actually skip one part of the relationship between fire and heat. So heat and fire are very similar, and the characteristics are also similar. The heat and fire, we use these two terms. We use both terms. We only want to distinguish how severe the heat it is. So if not very severe, you can use heat. If very severe, we call it fire. So that's only according to the degree, how severe. If not that severe, it's heat. Become worse or more heat. When it accumulates, we call it fire. So these are actually the same stuff. The next question we're going to talk about is the source of fire. Where does the fire come from? The fire can come from the climate in summer when it becomes very hot. The fire can come from the food when you eat a lot of deep fries or hot property food. When we discuss the materials medica, we mentioned what kind of food considered as hot. The fire, apart from the exogenous factors, the fire also can be transformed from the other pathogens we already mentioned, such as the wind, the summer heat, the dampness. And then these pathogens, when you go through the body, if it causes stagnation. So these pathogens stay in the body, it stays there, it doesn't move. After a while, it can change, or you can create the fire in the body. How does it work in this? Of these theories, it's very similar. You put for instance, from the garden, you cut the grass, you trim the grass, and then the grasses you put in the corner. After a long time, the grasses at the bottom or inside of all the grasses become fermented, and then when the grass becomes fermented, there's a heat. You can feel it's warmer inside of the grass. So this fermented only happens when you put all the grasses there. You don't move them, which is a stagnation in the body. So the other pathogen, when they go to the body and they stay there, they stay still and then cause stagnation after a long time, these pathogens also can transform into fire. It also will depend, this transformation also will depend on the body constitution. So we introduce this in our diagnostics more in details how these pathogens going to transform into fire. And the fire is not. We also have a physical fire, which is the heart fire or the kidney fire. This fire we need to limit in the imbalanced level, or we need a fire but we don't want too much. If you got too much hot fire, you will have the irritation or insomnia. You don't have enough hot fire, the patient may feel the slow heartbeat, or the patient also may have palpitation. So these are the abnormal of heart fire. That's exactly why when the treatment for the fire, we need to balance. We will not clear the dispel or clear the fire. We will not clear off them. You need to keep some of the fire. Otherwise, you will go to the other aspects, which is in pathogen. So these are the table for the fire. These symptoms can be fever, sweating that's due to the fire, can disperse the body fluids, flushed face, the red face, dental ulcer or gums problem, inflammation in the gums, swollen and sore gums, headache. So these are, you can go through them. These are the common symptoms of fire. So until here, we have introduced all the 6 exogenous factors, all the 6 evils. And here are some key points. That's the exogenous factors, as from the name, that's exogenous. It means something external, from outside, not from internal. So this is the one aspect you need to remember, that these 6 factors are from external invades our human body. And then when we study more for the pathogens, we also going to introduce the internal pathogens. The internal pathogens also have the fire, internal fire, or internal cold, which is from yang deficiency, internal heat, which is from yin deficiency heat. So when we use the fire or coldness, we have internal and external. And here the 6 exogenous pathogens, the one we talk about is the external. And the other key points, or very quite confused points, is for summer heat. We have mentioned quite a few times late summer. That what exactly late summer it is? Late summer from the 5 elements. The late summer is related to the spring, and the spring, when we introduce the late summer in 5 elements, I said that there are 2 schools of late summer. The one is late summer is at the end of the summer and early autumn, or the other school of late summer is at the end of each season, so spring, the last 18 days of spring, the last 18 days of summer, and then the last 18 days of autumn, and the last 18 days of winter. These 4 last 18 days of each season are called late summer. When you calculate them, 4 by 18 is 72. So 72 days considered as late summer, but spring, 3 months of spring is 90 days. 90 days when you deduct 18 days of late summer is 70 days, 2 days as well. So in this school, it tells us that the spring, which is 90 days, but the last 18 days is considered as late summer. The summer as well, autumn as well. So from here, these two schools, and when you look more, there are actually more different schools on late summer. But as our study in undergraduate or postgraduate diploma here, you don't need to focus on which one you want to choose or why there's so many debates on this topic. What you need to do or what we need to understand more here is to remember to understand the characteristics of these 6 exogenous factors. And then this will be enough for our future practice. And if you have the chance to further study the theories, then you can study more on these debates. So as same as the 5 elements, we have focused quite a few times here when you study these pathogens. Think about an image in your brain of the actual stuff, the actual dampness, the actual coldness, the actual fire in your fireplace. So think about those actual stuff, those physical stuff, and then try to compare with the characteristics we introduced here and then the actual stuff. Which one is matching? And if these are matching, when we apply to our human body, to different parts of the human body, what will happen? So you can see we actually introduce a lot of information or contents here. You need to practice your way of thinking. For instance, for fire, if we got excess of fire in the body, the fire can cause damage, and the young pathogen is going to move outwards. So you need to think about move outwards. If the fire moves to the eyes, what happens? If the fire moves to the ear, what happens? If the fire moves to the face, what happens? If the fire moves to the mouth, the throat, that's all the upper parts of our body. The fire also can affect the gum, the dental problem. So what will happen if the fire, from the characteristics of fire, you need to think about the symptoms of the fire. The fire also can affect the lung. The fire can affect the skin. These can cause the different problems. So after studying this, you need to think about, the more you're going to think, the more interesting you will find from these theories, because these theories are actually from our daily life. We see them, we see the phenomena, but we don't realize the knowledge behind these phenomena. Okay, we're going to stop here today, and then in the next video, we're going to introduce another pathogen, another new pathogen, which is also very different from these 6 exogenous pathogens. Thank you, guys.